Happy Nurses Week 2025. My name is Suzanne Priest, and I am your practice consultant here at ANBLPN. Since joining ANBLPN in November of 2024, I have almost weekly, if not weekly, received numerous emails and phone calls related to the scope of practice of LPNs in New Brunswick, and taken part in meetings or phone calls related to the scope of practice of LPNs across Canada and whether we allow something or we don't allow something in the employer setting or the regulatory body allows or does not allow something with the scope of practice of LPNs. So because it is something that probably I answer the most questions about in this role as your practice consultant, I thought it would be a good week to review things to consider when you're discussing your scope of LPN practice, or if you're the employer of LPNs, things to consider. And also that at the end of this presentation, you're more than welcome throughout the year to contact ANBLPN for guidance, for questions, and for clarity. So without further ado, let's get started in discussing the scope of LPN practice in the province of New Brunswick. I am going to shut off my video so that you can concentrate on the slides, and then I'll come back on towards the end. Thank you. So scope of practice refers to the activities that LPNs are authorized, educated, and competent to perform. I think we're all pretty familiar and comfortable with that concept. I often think that people forget to say, is there any federal or provincial legislation that might have something to say? Quite often, federal and provincial legislation is silent. But we must always start with the thought process of the federal and provincial legislation. So essentially asking yourself, is there anything in legislation that guides my overall practice? And additionally, this particular situation that I'm questioning right now, whether or not it's within the role of myself as an LPN or as an employer for the group of LPNs working in my workplace. The legislative scope of practice is outlined broadly in the LPN Act. I took a picture of the first page. It was amended in 2014, and Joanne Graham, our executive director, has asked me to share that we are in the early stages of starting another revision, and that to stay tuned, she will keep membership involved, or updated, as well as involved throughout the process. I wanted to point out today also that it's sometimes another piece of legislation outside the LPN Act that might impact your practice. So when you think of medical assistance in dying, there's things, for example, that a nurse practitioner and a physician who are the two professionals that are obtained consent for medical assistance in dying. And tidbits of information like that are important to consider depending on what the role is that you're embarking on, or that you have started to do in your practice. ANBLPN, we often will refer to our standards of practice, which are national standards, a national code of ethics, and then practice guidelines and fact sheets that we have created. It's because legislation is silent, oftentimes related to the specifics. There is no list of tasks of this is what an LPN can or cannot do. And so these additional documents are to help problem solve, answer questions, and guide the practice. On this slide, I show the front cover of the Standards of Practice, the 2020 Standards of Practice for LPNs. I encourage all employers of LPNs and each LPN individually to be familiar with this document and to be familiar with the CCPNR Code of Ethics as well. These are key documents, foundational to our practice. And as you will read on slide one, on the slide, to the left on standard one, LPNs are accountable and responsible for their own practice, their own conduct, and their own ethical decision-making. So that leads me nicely into this slide on accountability and liability. Being a self-regulated profession, so whether you're an LPN, a registered nurse, a nurse practitioner, a physician, a pharmacist, any of us who are regulated healthcare professionals, it means that we are responsible for what we do and what we don't do in situations where we should have done something. We sometimes refer to that concept as inaction. So for your actions and your inactions, we're responsible for that. No finger pointing. Therefore, because your practice is your responsibility, it means that we need to be familiar with what's expected of us from the ANBLPN and from our employer's perspective. Within the healthcare system today, nursing professionals, so the RNs, the LPNs, the nurse practitioners, we share many nursing competencies, and there are new competencies being added to both scopes of practice. So all three sets of scopes of practice in the nursing family. The RN and the LPN practice overlaps in many, many different scenarios and situations throughout the workday. So therefore, the nursing profession can no longer be just identified by a list of tasks or activities, as I previously said. So today, I'm hoping at the end, we will all have an understanding of what impacts the scope of practice and what are some of the considerations that we need to have or really need to consider. One of them is the professional scope of practice, the individual scope of practice, and then the scope of employment. I really like CNA, the Canadian Nurses Association of Canada, the Canadian Nurses Association, sorry. In 2019, they wrote, the healthcare system is better served when the legal and professional scope of practice is one, broad enough to support flexibility in order to respond to the changing healthcare needs. Two, enables nursing professionals to work to their full knowledge, skills, and abilities. And then three, provides support for intra-professional collaboration, meaning within that nursing family. The individual scope of practice is based on the LPN, your current practice, your context, the education you've had to this point in your career, clinical experiences, and competencies that you've learned during your initial formalized nursing program, and then PM program, and then on the job education, extra courses or conferences you might have taken. We, clear across Canada, graduate from similar diploma programs for the LPN, for the practical nurse programs, and we write the same national exam. However, as you know, clinical experiences in the education system while you're out in clinical and after graduation really shape for us to have very much so individual scopes of practice. And that is good. Individual scope should never be stagnant. It should evolve over time. All of us should be learning and attaining additional competencies in relation to our practice environment and where we're working. But conversely, on the other side of the coin, LPN scope can be individualized to the point that it minimizes our ability to maintain skills and competencies that we might have learned or we might have accomplished in working in another practice setting. So I thought that because of that reality, that it would be good to go over just a couple of practice scenarios throughout this presentation related to an example showing how is the LPN competent or aren't they? Are they able to proceed with this planned task or aren't they? So here's the case setting. An LPN has been working in long-term care for 15 years. She's recently taken a new job This opportunity is in an acute care hospital. As the LPN begins their morning shift, they receive an order to receive a catheter on one of their patients. The LPN remembers that they were taught this skill in their PM program and that she performed it as a student. That this regular nursing task is authorized to be performed by LPNs in the current practice environment here at the hospital. However, the LPN hasn't performed it a lot in her past working experience over the past 15 years. So she's not certain, is this within her individual scope of practice, her employer scope, her professional scope? Should she proceed or shouldn't she? So here's an example. Did she learn to perform this activity in her practical nursing program? Yes, she did. Has she been able to maintain the ability to carry out the nursing intervention safely? No, she hasn't. So right here, I'm showing that you can attain a skill, you can attain knowledge, but if you are not able to maintain it, meaning you can forget it or become a little rusty, then that doesn't mean that you should proceed. Is the nursing intervention part of the current workplace professional scope of practice? So does that employer authorize the intervention? And does ANBLPN give their professional, yes, their stamp of approval? The answer is yes to both. So what should she do? In this best case scenario, if you're ever faced with a situation like this, you need to disclose to the nurse in charge. You need to request help, review the policy and procedure for this current workplace, speak to a trusted colleague for assistance and mentorship. And if there's any learning modules or formal certifications that's required for the particular task that you're going to perform, or it's expected that is now part of your role as an LPN, then you need to do that. So speaking out, notifying the nurse in charge, being truthful about it, that is the very first step. Remember, everything we do should be about patient safety and what is best for the patient or the client. So now I want to speak briefly on the scope of employment. LPNs are expected to optimize their individual scope of practice with employer policy within employer policies. And if there isn't an employer policy, you really need to advocate for there to be one to guide your practice. Scope of employment changes from employment setting to employment setting. And so therefore, we are accountable to know what's expected of us in each area. And if you work in more than one area, you need to be very knowledgeable of what's allowed or not allowed in each workplace situation. The individual scope of practice and the scope of employment may exceed the professional scope of practice. So this is when, if you are being asked to do something by a physician or a nurse practitioner or an employer, and you're not certain that you should be doing it, this would be a great time to check in with us here at ANBLPN, or to have the formal leader check in to see if this is something that's acceptable from a legislative and from a regulatory body perspective. So I gave the example. I thought I would share that earlier on in my career, I worked on both sides of the border. I worked in the state of Maine, and then I worked here in Fredericton. And when I was working as a nurse in the state of Maine, I could not insert an NG tube in a newborn without a doctor's order. But when I worked here in Fredericton in the neonatal intensive care unit, I was able to do that. There was a directive to support the practice. We were trained. We had the knowledge, skill, and ability. So that was a situation and a prime example. Because I crossed the border didn't mean that I lost that knowledge, skill, and ability. I still had that. So you going from one unit to another, even within the same facility, you need to be aware, is there a limitation on my scope of practice because of the employment setting? So that's what I'm getting at here with this slide. Your employment policy can have a big impact on your practice. So please be aware of it. And if you feel like it's something that, other places are doing, why isn't it happening here? Then that's a great opportunity for advocacy. So hopefully we've now established that there are things that can change your scope of practice, like the employer, the patient, the acuity, the complexity of the patient. When you think of that 3-factor framework, what's that risk of negative outcome? And your personal competence, your individual experience, recent experience, your individual learning that's happened since your practical nurse diploma was achieved, and then the work environment. So I think this would be a good time to go through a second example. An LPN is working in a community nursing center. She receives her list of client visits for the day. One of the clients requires blood work. The LPN graduated in 2005 prior to the phlebotomy checklist being and the phlebotomy teaching being a part of the regular practical nurse program. And guess what? They have not taken any post-basic education related to phlebotomy. The LPN consults with the regulatory body and determines that phlebotomy, yes, it is indeed within the provincial scope of practice for LPNs here in New Brunswick. And the employer informs the LPN that they've recently revised the policy to authorize LPNs to perform the nursing intervention. So in this situation, even though legislation is silent on it, and the ANBLPN says, yes, we have education and it is very much within the scope of practice for LPNs. And even though the employer says, look, I just revised a policy, you are authorized to do this task, it is not within the LPN's personal competence. So it means that it is not within her scope of practice until further education and training. So the takeaway from this example is if you have not been educated nor performed the activity, you cannot perform the intervention, even if it is within the professional scope. However, that's not a get out of jail free card, as they say when you're playing Monopoly. You should work with your employer. It is expected that you would work with your employer to get the education and the mentorship and the training to be able to do what's expected of you in this current practice setting. I think it's very important for us to have a reminder of the GPN scope of practice. We do have a document online under the Members Resource tab related to GPN scope of practice, but I wanted to touch on this briefly today. So the scope of practice for the graduate practical nurse is consistent with that of the LPN. However, we must remember that a GPN will have a limited scope of practice. They do need mentorship. They do probably need some teaching moments while they're starting out. And again, let's remember, not just for the GPN, if you have someone like in one of our previous examples is coming from a practice setting where they didn't exercise or use some of the skills that your current place of work is using, welcome them into the team, be a mentorship, be a trusted source that they can come to and disclose, you know what, I haven't done this in 10 years or 15 years. Could you walk me through the steps or supervise, mentor me as I do this for the first time in a long time? I think that would be very welcoming and probably help with retention. The GPN scope of practice does allow for the GPN to work collaboratively under the guidance and director of a qualified, not just a medical practitioner, indeed the medical practitioner, but also a registered nurse, could be a nurse practitioner, could be a pharmacist if it's in that clinical setting that's in the community. So I just want to say that it is still the same legislative scope from that perspective of working under the direction and in collaboration with an RN, pharmacist, nurse practitioner, or duly qualified medical practitioner. GPNs may administer all prescribed medications within the professional scope of practice in which they have the individual competency and have been authorized to do so with employer policy. So that's another question. Can they carry the narcotic keys? Can they give narcotics? Questions like that. The answer is yes. Just think of what's within the role of the LPN, and it's consistent with that, except they will have a limited individual experience. So that individual scope of practice is still in a very strong learning curve. But one thing that's important to remember is LPNs or GPNs, are not authorized to assume the role of the practical nurse in charge. So we couldn't go through a conversation on scope of practice without considering some legal aspects. So let's have a little conversation here about being knowledgeable of your regulatory expectations by ANBLPN and your employer expectations. You are responsible to be aware of your standards of practice, your guidelines, your policies. This is something that as a licensed healthcare provider, you have the responsibility to be aware, to know what you should know. Self-reflective practice is just like we've walked through in those last two examples. It's about identifying any needs, any gaps that you may have to both attain and then maintain a competency. If we refer back to the LPN Act, how LPNs work under the direction and in collaboration with other healthcare providers, when you need to consult or advocate, do not forget to document. From a legal perspective, that is extremely important. And then the other thing that's really important, this is a good place to put in a plug for the continuing competency program, is to keep a record of your learning and clinical experiences. So in plain terms, I've written along the bottom in red, ignorance of standard or policy is not a defense. Saying, oh, I didn't realize that is not a standard defense. You need to ensure that you are aware of your ANBLPN standards, code of ethics, guiding documents, and your workplace policy. So don't groan when you see the word documentation. Why? Why is documentation a part of this presentation on scope of practice? Well, it's because documentation is not optional, and my goodness, is it ever important. Additionally, we need to consider some things when we refer to the consultation. What should you document if you're reaching out for some support or some consultative advice or direction? What are some things that you should document? One is the reason for the consultation. So if it's vital signs, if it's a change in status, just objectively as possible, write down the reason for the consultation. Include the name and the designation of the person that you're consulting or collaborating with. And additionally, what was the outcome of the collaboration? Were you given orders to do something, to give a medication, to perform a certain task, maybe increase vitals, check blood sugars more frequently? What was the outcome of the collaboration? And one of the things that's really important for me to share is that you just don't use the old adage RN aware or physician notified. That doesn't cut it. You need to say who you consulted with and their designation. That's important for continuity of care. It's not helpful from a continuity of care perspective if we don't know who talked to whom. And so if you think about it, the next shift, if I'm working with someone that knows of the situation and I see that Mary Smith, the LPN, consulted with Suzanne Priest, the RN, and I'm now working with Suzanne 2 nights later, and I have a question about this care, it just is an indicator of, oh, Suzanne would know what went on there if I have specific questions. So think of it that way from the continuity of care perspective. If it's a physician covering a night shift or a weekend, and they know the name of the physician that ordered something in particular, if they wanted to reach out to them for clarity, it offers that opportunity. So don't be afraid of that. And if you're challenged, that's where you can, invite the person to contact me here at ANBLPN, and I can explain the rationale on why we encourage the name and the designation of the person that you're collaborating with. You should not have subjective comments in this documentation, however. So this is not a place where you can degrade or run down your coworkers or put in any comments that might be unprofessional related to the person that you were consulting with. So this leads us to the question of, am I practicing nursing? I will get a query from time to time about this. If I do such and such a role that's outside the traditional role of an LPN, is it considered nursing? Can I count the hours, etc.? So we have on our website a document that's very good. I took a picture of it. If you walk through and read and reflect, I think that this document will answer your question in almost any situation. And this is the other question that comes along with this. Am I allowed to use the title LPN, the designation LPN, when I'm working? And I will let's give an example. If you go to medical aesthetics, if I'm doing something that is within the LPN role, then yes, you use the LPN title and you can count those hours towards a licensure. But if I am giving someone, a facial or a massage, if I'm working in a clinic or I'm doing something that it does not require an LPN to do that task, then no, I should not be calling myself an LPN, and I should not be counting those hours towards my license renewal. Another thing that's important to talk about is advanced competencies. And I think that that's where a lot of the questions are coming from, is because workplaces are evolving. This is very exciting for LPNs. Most LPNs are very excited, but there are some things that we need to consider, both as an LPN and if you are an employer or a formal nurse leader listening in today, then you need to be aware of some of the considerations with advanced competencies. So the LPN needs to have necessary education and clinical mentorship to perform the intervention. Again, we discussed the not only attaining, but then maintaining the knowledge, the skill, the ability. There does need to be employer policy to support the practice of the LPN. The competency is to be consistent with the legislative scope and then the regulatory scope. So if you have any doubts, please ask us. And the competency needs to be prohibited by law, meaning right off, I've had some questions about medical assistance in dying. There's some very clear guidance And then there's a couple of areas that's a little bit gray. And so that's when a conversation sometimes have to occur with us here at ANBLPN. So again, a final caution that it's not only to attain the knowledge, skill, and ability, but to maintain it as well. So then this leads into the slide on risk management. We need to be aware of any workplace policies, guidelines, and procedures. As a licensed nursing professional, you do have responsibility to know about these. And I've said this now, I think 3 times. So obviously it's very important. And I will tell you that that's some of the questions I get or some of the responses I get. Oh, I was not aware. You need to be aware. Additionally, be aware, check into the website from time to time. For example, since coming to work here in November, I believe there's between 5 and 7 new documents that have been created. Come on over, have a little look, read the blue band. If there's an email that comes out, especially around the time of registration renewal or something related to continuing competency, just don't delete that or stuff it in a junk file. Literally, you are responsible to be aware of what we're saying to you. Take that moment, pay attention. And if you're in doubt, or you just really want to have clarity, give us a call or send an email. I think the easiest way, so you don't have to worry about a contact email or a contact number, is the ANBLPN.ca webpage. If you go up to the top, there's a contact button, and it will, it says practice query, or if it's an initial registration, or it's an education type query, we tell you what option to choose on the main phone line. So for example, I'm option number 2 for a practice query, and that is all there under the contact button at ANBLPN, along with the email. So communication of your scope of practice and your role in the workplace, and then learning that of your other team members, is what's really important about communication. And the reason why is because studies have shown when team members know and understand the scopes of practice of their team members and their roles in that current healthcare team, it leads to greater trust, greater job satisfaction, and safer patient care. And that really makes sense if you stop and you think about it. It would also reduce stress. If I know that this person can do this and they have policies to support that they can do this task, then I don't have to worry about, can I ask so-and-so to do this or can't I? So think about the stress reduction. Think of the consistency and the time saved in the continuity of care when we collaborate and communicate and know who each other are and what we do and the role that we are allowed and expected to perform. So I'm going to turn the camera back on while I review some of these last key points because they are important. Thank you for being with me today. Okay. So we have gone over scope of practice, what defines the scope of practice, and it's what we're educated to perform. It's also what's supported by employer policy. And it's either silent in legislation or there's a specific shout out in legislation to either do it or not perform the task. So for example, I use the medical assistants in dying as an example. NPs, nurse practitioners, and physicians can attain consent for medical assistance in dying, but the LPN and the RN cannot. So that's an example of clear-cut legislative guidance to scope of practice. The other thing is that we are self-regulated, and so therefore we are accountable for our actions and our inactions, that we have a dynamic scope of practice that includes both or three things: the professional, the individual, and the employer considerations. And then the importance of competence, both attaining it and then maintaining it. The importance of documentation, that it's essential to document, and that when you are reaching out to consult with another healthcare professional, what was it that you were consulting them about? What was their response? A name and a designation. Advanced competencies, we've gone over that. So things to consider, how you attained it. Is there, if it wasn't formalized, a formalized education program or a course that you took, then how are you going to keep proof of the head knowledge that you acquired and then the clinical skill that you acquired? Did someone supervise you? And you can sign and date that, both of you. So think about that when you're doing an advanced competency, in case you were asked or you were challenged on whether you were competent to perform the task or not. Have evidence of how you attained the skill, that both knowledge and clinical skill. Stay informed. So employer expectations, ANBLPN expectations, what is it that we expect of you? And the importance of teamwork. Effective teamwork, there's that old cliche, makes the dream work. Teamwork is the dream work. Well, truly, we can laugh about it, but don't let it just be a cliche. It's truly important that we foster trust within the team, that we know who does what, what's their ability, what's their, does someone have a special certification in something that the rest of the team doesn't? If so, they need to know that, so that if someone walks through the door, say, for example, with a gaping wound, and you have someone on the team that has, wound certification, an NSWAC, for example, we need to know who does what in our place of employment. And as a thank you, I just wanted to share, again, some of the resources that I used in creating this PowerPoint. And I wanted to say Happy Nurses Week once again, 2025. And don't forget to check in on us, some of the new documents we're creating, webinars such as this, and just stay tuned. Thank you very much and have a great rest of your day.